My name's Rosemary Arnott. I'm a geriatric medicine registrar and teaching fellow in elderly care medicine and general medicine here at NUH. And this morning I'll be conducting two presentations based on two different digital learning packages that I created or helped create. One of them was a group project, one was an individual project for medical students. They were created as part of the Technology Enhanced Education module for the University of Nottingham Masters in Medical Education, which I'm currently doing at the moment. So although the two learning packages are a bit different, the main theme running across both of them is collaboration. And the second package was made in collaboration with allied health professionals who were in the geriatric medicine multidisciplinary team, and Jem Thacker, who's a senior physiotherapist and trainee advanced clinical practitioner, and Naomi Mugaba, who's a deputy assistant in geriatric medicine at NUH, will be joining me for that one, which is really good. This was a project that Jem and Naomi have been involved in for a few months now, and actually happened to tie in with this module. It was an idea I came up with quite a while back when thinking around the work of the multidisciplinary team within geriatric medicine. Jem and I were just going to have a bit of discussion around the background to the project. I was then going to show you the project itself and ask Naomi as well about it, and then we can talk about sort of how we're going to use it into the future. But I mean, Jem, you have a lot of experience in working in the elderly care department as well, and the importance of the multidisciplinary team in elderly care medicine. I don't know if you want to sort of expand a bit on.
I think it's just a really important, especially for elderly care. I think from a holistic point of view. I mean, the elderly as a population have so many things going on, and sometimes it's better to look at it from a holistic point of view rather than just either a medical point of view or a functional point of view. We sometimes need to come together to figure out what's going on with the patient and where they're going to go to after their medical problems are optimized.
It's all about quality of life, really, and how to improve the
Absolutely.
quality of life of your patient. And actually, to make that team work well together is actually really key. And that involves good teamwork and good collaboration between each other. So that's why I wanted other members of the multidisciplinary team to support this project, to collaborate, to create the project, to create the resource, as well as showing collaboration through the resource, if that makes sense. So, you know, sort of it involves respect, shared goals, and knowing what the roles of each person is. So the project sort of came about because we were having difficulty organising interprofessional learning days within our departments and actually getting collaboration from other departments, timetabling, people being people being available to come and teach. And so actually I then approached Jem, Naomi, and a OT, speech and language therapist and dietitian to actually explore whether we could create some small videos around their roles. And then because it's obviously their face, and that fits with the learning objectives for the medical students for the HCOLL curriculum, but also then to expand on the idea of teamwork and teaming later on in the learning package. So why did you want to be involved in this project? And what benefits did you see for the students in doing this?
This project has been really effective. I've been applying as well with my nursing students on the ward for them to be able to know the importance of the MDT roles and how collaboration between health professionals is towards patients' care. It also helped me to understand and helped the students to understand how can we implement comprehensive geriatric assessment effectively if we know our health colleagues like physios, dietitians, and medical team, that they are there to support us when we want to implement patient-centered care plan.
So one of our aims, hopefully, is that this won't be just medical students who'll be able to benefit from this learning resource, but actually other allied health professionals as well. So it wasn't just aimed at them. So I'm just going to show you the package. Yeah, so this is learning package. So basically, we created the video. So the introduction is around the acute inpatient geriatric multidisciplinary team, describe differences, compare and contrast roles, describe how they complement each other, and then talking about what effective teamwork looks like. So basically the first part was summarising the roles of the MDT and trying to get some background knowledge for the students. And then the next part is the MDT videos. So for each video to consider about what's similar or different, how they contribute to wider MDT, and are there any themes that run across their videos. So on the first slide, we've got Jem, and then we've got Siobhan, who's an occupational therapist, talking about their roles and how they contribute towards the MDT. And I gave her 3 questions, and then they expanded on those, videoed within the department here. Then we got speech and language and dietitian, which was Farah and Rachel, and then myself and Naomi discussing our roles. But obviously our roles don't work together unless you're working as part of a team. And so then I used this really good TED talk, but basically it's a TED talk from a lady called Amy Edmondson around the concept of teaming, so teamwork on the fly and how we work as together as teams. And actually one of the central points that she raises, which I think is really important in the MDT context, is the concept of humility, that we don't all know everything, and that actually thinking about what we contribute towards the team and how other members can contribute is really essential, and that's a really key part of the multidisciplinary team. And then there's some questions to ponder, and hopefully they then feel more confident around what the role of the MDT is at the end of that. So moving forward, I think the problem I've had is that it's not yet integrated as part of our learning within our curriculum. So I created it during the year. Our plan is that it will be part of a blended learning package, so that this will be something that the students will need to watch before their final workshop day on the last day of their teaching session. And then during their workshop, we will explore the themes further, have some sort of simulated sessions where they can practice being different members of the team and how different members of the team contribute, and sort of practice that sort of team working aspect and how different people can contribute towards a team. It's been very well received by the medical school, and from the students that I have interacted with, they felt that it's a useful addition to their learning moving forwards. So yeah. Thank you very much, and thank you, Jem and Naomi and Lavanya, for your support this morning in putting these presentations together as well.